is MD in anesthesiology, working in SRM Medical College Hospital and Research Center. She is a certified pain management physician from National Health Education England. She is a UHV coordinator for SRM College Hospital and Research Center. She is into this UHV journey since 2023. She is a life member of the Indian Society of Anesthesiology and member of the Indian Red Cross. With this, I would want to welcome Murunalini ji. Dr. Murunalini ji, over to you. Welcome to day 2. Didi, you'll have to unmute yourself.
Thank you, Dr. Prachita ma'am. Thank you for the warm introduction and for welcoming us all. So I again welcome all the panelists and the delegates who are present here for this day 2 of a Holistic Human Health panel discussion. So it's nice to see you all back here. And today we'll be discussing about the vision for holistic human health. So yesterday we began by exploring about the current state of health of our youth and of the health system through a SWOT analysis. So today we'll move a step forward towards envisioning what a holistic health system would truly look like. And before we begin the discussion, I would like to once again introduce all our panelists for delegates who are watching through various other channels and the other delegates who are present here. So we have with us Dr. R. Sujata, and Madam is a principal at Subbulakshmi Lakshmipati College of Sciences with 27 years of teaching experience. And Madam has previously served as Deputy Directors and Dean and Director of Projects and Dean of Students Affairs in various other colleges. And Dr. Sujata has been honored with the Academic Leadership Award 2024 and multiple Best Administrator Awards in years 2021 to 24 and other recognitions for her leadership and motivational impacts. So Madam was appreciated for her many speeches and she has received the Best Motivator Award for National Blood Donation Day in 2023. And very notably, Madam is also the author of the second edition of the textbook Value Education, which was published at her institution. So it's a pleasure to introduce you, ma'am, and welcome to the panel. And we have with us Dr. Umang Munjal with us. Dr. Umang Munjal is a veterinarian researcher and a diagnostic professional with a strong international academic background. She has completed her PhD with a doctoral focus on cancer prevention, and professionally, she currently serves at Roche's Diagnostic Mannheim in Germany. So beyond her professional work, Dr. Munjal is a voluntary member of UNICEF in Germany and actively supports global health and many welfare initiatives. Her interest in holistic health, preventive medicine, translational research, along with her grounding in philosophical wisdom, I hope would bring a unique perspective to our panel discussion today. So welcome, Dr. Umang. Ma'am, if you can just adjust your video a little bit, that will be good. And we have Dr. Vidya with us. So Dr. Vidya is currently serving as an assistant professor of anatomy at Jipman Institutes in Pondicherry. And Madam is also a secretary of Sri Paspo Educational Institutions in Tamil Nadu. She is an accomplished academician, researcher, and award-winning anatomist. And she is a life member of several professional bodies like Association of Anatomists of Tamil Nadu, Indian Medical Associations, and Society of Clinical Anatomists. Her special area of interest include genetics, embryology, neuroanatomy, and innovative teaching methods. She strongly believes that the best learning happens through teaching. So welcome, Dr. Vidya. And we have next with us Mr. Swapan Chanana. So sir is a highly respected educator with over 25 years of teaching experience in the Department of Business Management at PCTA Group of Institutions in Ludhiana. In addition to his academic role, Sir serves as the Director of Students' Welfare, playing a very key role in student development and well-being. So Mr. Chanana, sir, he regularly teaches the subject of universal human values to students across the disciplines in his institutions, and he is deeply committed to value-based education and holistic human development. Welcome, sir. And we have with our student panelist for this session, Mr. Shobit Raj from SRM Medical College, Chennai. So currently he is pursuing his medical education and he is keenly interested in learning through dialogue, values collaboration, and respectful exchange of ideas. And he is very eager to understand the real world applications of the topics being discussed. So, welcome, Shobit. And we have Mr. Nilanjan Datta with us. So, it's a pleasure to introduce Mr. Nilanjan Datta. He's a committed healthcare educator and a clinician, and he is currently serving as faculty in Operation Theatre Technology at Medhavi Skills University, Sikkim. He holds a double gold medal award for both his undergraduation and post-graduation degree. So, Mr. Nilanjan brings a strong clinical experience and academic excellence and a passion for outcome-based education and innovative teaching methodologies. Welcome, Mr. Nilanjan. And we have Ms. Aditi Parikh with us. So, Ms. Aditi Parikh is an emerging professional with a strong academic background in biological sciences, education, naturopathy, and yoga therapy. So, this reflects her deep interest in natural healing, holistic health, and mind body well being. So, Mr. Parikh is recognized as a confident speaker and an efficient communicator, and she has received multiple awards for oratory excellence during her training programs. She has also participated in self transformation and many well being workshops. So, this is the panel team gathered with us today. And I once again welcome all of you esteemed panelists. And I thank you for taking your time and joining with us today. And I really hope that we have a very joyful and an enriching panel discussion ahead. So, before we dive into the discussion, I'd like to share once again the format of this panel discussion. So, this entire session is scheduled for 90 minutes and it will begin with a briefing of 20 minutes of the point of view that is going to be discussed today for the topic. And following that, we'll have a moderated question answer session with the panelists. And once that is over, for the last 10 minutes, we'll open the session for open questions with the delegates and other participants through various channels. And even panelists present here can interact openly with other panelists. So, this is the format. And with that, let me begin sharing the point of view for today's topic. So, I hope the screen is visible to all. So, today is the day 2 of panel discussion, and the topic for today is Vision for Empowering Youth to Take Charge of Their Health Holistically. So, just let me begin with a small recap of what we discussed yesterday. So, yesterday we saw about the SWOT analysis, that is the strength, weakness, opportunities, and threat analysis of current state of health of youth and of the health system. So, we saw that there are many strengths in the current health system, like how the communicable diseases have been reduced drastically, how antibiotics have revolutionized the medical care, and how vaccinations have led to eradication of global diseases like polio. And trauma care is so advanced, and many state of art techniques, surgeries, and procedures are saving many lives. And we also had a discussion on the weaknesses of the current health system, particularly about this lack of holistic approach in the current health system, where the body seems to be the major focus, and specialization and super specialization they further divide this. And also, when dealing with physical health, we saw that it was largely disease centric approach, where we work more often to bring down the symptoms and managing the disease for life. And there's a lack of understanding for the root cause of the disease or for the actual cure of the disease. And we also saw about how we deal with mental health. We saw that it was often treated with medications that are given to the body. And there's a huge question remaining about the root cause of mental health. And again, we discussed about the values and ethics, the unaffordable state of the health condition to health systems today, and also the unsustainability of the health system. So, with this, we saw that there is scope for exploring other opportunities. And then we saw many statistical reports about the threats and challenges that the health of the youth and the health system faces today, both physical and mental. We saw particularly about the alarming state of rise in non communicable diseases among the youth today. So, with all these things, we all came to a consensual conclusion that there is a need for a holistic and a sustainable perspective for health. So, with this, let us move on to today's viewpoint where I'll place the proposals. So, when we see here, the current approach here is the disease centric approach. So, here in this approach, the physical health is largely equated to getting rid of the diseases. So, we can ask whether this approach is adequate or inadequate. And in this system, in this approach, there seems to be a huge rely on medicines and treatment and laboratory tests for um, taking care of the diseases. So we can see whether is it really solving the problem or only suppressing the symptoms. So here we suggest the need for two major paradigm shifts. The shift number one is moving from symptom suppression to treating the root cause. And the second major paradigm shift is moving from focus on disease to focus on the health. And for this, the proposal we place here is the health centric approach. Here we can see that there is a program for physical health, that is, program for staying healthy, where there are four steps that have been suggested, like intake, lifestyle routines, and followed by labor and exercise, followed by postures for regulated internal and external body organs, and incorporation of regulated breathing. And only as a last resort, we move on to relying on medicines and treatment. So we can ask, like, when we frame our health education system, should the healthcare be focusing on one, two, and three steps, and then on four, or should it be focusing only on the fourth step, that is, only on the medicine and treatment? And then we have the body centric approach. So here again, we see that the human being is seen as just the body. And in this approach, there's a idea that brain is in charge of the body, and this is responsible for all parts of the body and their functioning. And this leaves many questions unanswered, especially the psychosomatic diseases. Like, there are questions like the fundamental cause of psychosomatic diseases, like essential hypertension, diabetes, arthritis, cancers, and many other autoimmune diseases. So here we suggest the need for the third paradigm shift, that is, moving from this body centric approach to inclusion of the self and the body approach. So when we say this mind body approach, here the human being is seen as the coexistence of self and the body. So when we say self, for the purpose of today's discussion, we like to equate self to mind, but in reality, mind is a, a small part of the larger self. So here in this mind-body approach, the proposal is that self is central and it instructs the body through the brain, which is part of the body. And through this approach, the root cause of most of these diseases is easily understood. And it addresses many currently unanswered questions regarding these psychosomatic diseases. And when we understand the self, we can address the problems at the root, that is in the self, and we can tackle these psychosomatic diseases far more efficiently. But of course, we need to have more research in this area of consciousness, and this may help us deal more efficiently and adequately with mental disorders also. So let us take an example about the perspective on stress. So the current perspective is that stress is something that is outside, that is like stressful situations, stressful activities, and people, they stress us out. And then we resort to stress management strategies like avoiding these stressful situations, avoiding stressful activities, and avoiding the stressful people, and involving ourselves in other activities to bust the stress. like involving in gardening, pottery, punching bags, and so on. But we can see the reality about stress. We can ask, like, is stress which is something which is actually out there, or is it something that is there within us? So we can see when a person is in harmony within themselves, and that person we can see is calm, comfortable within, and that is showing us harmony in the body. But when a person is in disharmony within, so he or she is uncomfortable, that is unhappy, the so called stressed within, and that shows as disharmony in the body also. So when one is in harmony, that is comfortable and happy within them, they respond to the person, activities, and the situations outside. But when the same person is in disharmony, that is unhappy within, they tend to react to the same situation, same persons on the outside. Like we can very easily relate when we ask this question to ourselves. Like, when does a mother beat her child? When she is comfortable with it, or when she is uncomfortable with it? So, in the moving forward, the body centric approach, the human being is largely equated to the body. And with this approach, there's a possibility that people do not understand themselves and they do not understand the cause of many diseases. So, when the cause of this diseases are not understood by the people, then there's a natural tendency to give the responsibility for the health of their body to the medical care and the health system. And so, people may or may not rightly utilize their body. But in the proposed mind body approach, where the human being is seen as the coexistence of self and the body, so when people have this understanding that being human being is not just the physical body, but we do have a self, and it is the coexistence of self and the body, then people tend to take responsibility for their health of the body and they rightly utilize the body. So just going a little deeper about the impact on the body of a from a healthy self. So when we say self, it is the consciousness unit. So we can see here in the purple box that the needs of the self are happiness and prosperity and continuity. And these needs are fulfilled by right understanding and right feeling in the self. Whereas when we look at the material unit, that is the body, the needs of the body are just the physical facilities like food, water, air, and they are all temporary in time. And these needs are fulfilled by physiochemical things. So, when this consciousness unit is healthy, that is the healthy self, with the development of right understanding and right feeling, then there is the natural development of feeling of responsibility towards the body, and this is shown as the proper nurturing, protecting, and rightly utilizing the body. And the natural outcome of this healthy self is a healthy body, where the body acts according to the self, that is the I, and there is harmony among the different parts of the body, that is, they are in order. And here the proposal is the self is central to human existence and the body is a tool. So, when we shift our focus to consciousness for keeping the body healthy rather than managing the diseases, then the healthy self automatically takes care of the outcome of the healthy body. So, with this proposal, we can ask ourselves one another question. So, is the human being an isolated entity, or is he a part of a larger whole in this existence? So, in the approach where the human being is seen in isolation, there can be a possibility of lack of clarity about the human being and the environment in which we live. So, this can lead to broken homes, like broken families, and there is a lack of sense of relationship with other human beings. So, when there is this lack of a relationship with other beings, then there is a lack of trust within each other, and this leads to fear in the society. And also at the level of nature, we tend to make attempts to dominate the nature. So all of these put together, it results in the ill health, both mentally and physically. So here we suggest the need for a fourth major paradigm shift, that is moving from seeing ourselves in isolation to understanding that we are a part of a larger whole. So the proposed approach here is to view human being as a part of a larger whole. That is, human being is a part of the family, a member of the society, and a unit embedded in nature. So understanding the human being as the self and the body, and understanding the relationship with other human beings and with the nature, people have the feeling of relationship with other human beings and the rest of nature. And so, with this feeling of relationship, the natural outcome is a healthy self. That is a self in harmony. That is a happy self. So, to sum up, there are two approaches: the body centric and isolated approach, where human being is seen as just the body, and there is no idea about the self or the role of self. And for the health of the body, there's a huge rely on many laboratory tests for early detection of diseases. And also, we tend to resort to medicines and treatment to bring back the harmony in the body. And sometimes these medicines are taken for lifelong also. And there's many unanswered questions regarding the cure or the root cause of these diseases. And also, there's a lack of understanding about the environment in which we live. So, in the proposed holistic approach, here we view the human being as the coexistence of self and body, and here the health of the self is given the first priority. And for the health of the body, we propose this program for health, for staying health mostly, where we go in a stepwise approach where the priority is given to the intake and lifestyle routines, followed by labor and exercise, and incorporation of postures for regulating the internal and external body organs, and incorporating regulated breathing. And only as a last resort, we move on to medicine and treatment. Here again, there is an inclusion of the health of the environment, that is, the health of the family, society, and nature. So, with this, let us move on to the panel discussion. Um, so, let me begin by asking Dr. Sujata ma'am. Ma'am, I remember yesterday we had this discussion, and you were telling about this point, like how we totally rely on the health system for our health. So the question to you, ma'am, is, so do you think it is the right time to address the role of self in the health in a priority basis, ma'am?
Um, it is absolutely yes, actually. I want to quote one example here. Like my first daughter, actually, she got a fever in between the times, but she refused to take the medicine. What she said is, "How is enough, ma? I'll take care of my health. The fever will get reduced." Is what she said. So I was a little bit surprised why she's not taking the medicine. But the same fever is coming to me. I used to take medicine or injection to get cured. So it is not because of the mind what the people is having in their side. I felt that after taking the medicine only the fever will go. But my daughter is thinking that hot water is enough to make the fever go. So this is what the mind process between the human beings, and it is very much needed for each and everyone. We have to take care of our self. And at the same time, what you mentioned is very true. Among the whole body, this mind is actually controlling each and every cell. including the brain. The brain is actually getting the signals from the mind, and the brain is acting according to that. If our mind is free, we will be get relaxed in all our ways. Even you addressed the stress management also. The current scenario is completely filled with the stress. Everyone is actually having their own stress in their life. Even for me also at times it occurs. I have to come out of that means I have to make my mind free. So I should not take all things into my mind. So like that only I'm actually getting compromise on my own. So if I'm taking the stress, it will automatically affect myself. So if myself is getting affected, automatically my body also will get affected. So I used to feel that I'm so tired, I can't do any work. So all these things, I'm actually getting a feel. If I feel that the stress is actually on my side. So it is very much needed this time. Everyone has to take care of themselves. It is very important. And at all times, the people should not listen to their mind also. If there is a negative approach on our mind, if you listen to that, automatically we will also get into that negative lead. So we should not do that one. So we have to keep our mind free, which means we have to take care of ourselves.
Thank you, ma'am. That was really very insightful. How you see the importance of mind on the physical health, and how a very occupied and a busy mind leads to stress, and that has a direct impact on health. Thank you for that, ma'am. And I would like to ask Mr. Swapan Chanana, sir. Sir, you have been taking this universal human values classes for your students in your institutions. So, could you just throw us a little light on the role of self on the health, sir?
Greetings to all. Yes, even yesterday we discussed that this body-centric approach is not bringing the results, desired results. Means we can see that our health system is not getting sustainable with with this disease-centric approach and body-centric approach. So in this course of universal human values, even today in your presentation, you have given us the proposal. So even when I go to the classes and then we ask the students, and even before them, we can also do the research that is human being only a body or I am more than the body. So if I am more than the body, then what it is there. So then it's a proposal that okay, is human being only a body or human being is a coexistence of I and body. And because if I consider myself only body, and then rather than taking care of this body, I get into overindulgence. Like yesterday, means we have been discussing that means youngsters are today into anxiety and depression, and to come out of that, they overindulge. Like they don't sleep in the night, and they are attached to the gadgets, or and then they overeating, obesity, etc. So on the other hand, if this concept of I is there, then I think we can ask this question to ourselves and to them also. Then who has to take care of, who has to take the responsibility of the body? Means who will take care of the body? Means your parents or the health system, or I will take the responsibility of the body. And if you see in your presentation today, if I take the responsibility of the body, I feel related to the body, then I will have this feeling of nurturing the body, protecting the body, and doing the right utilization of the body. So I think this I has to be researched. And in this way, when I give these proposals to the students, they also take it in that way. And in that way, I think we can always present them in this way. They can do the research on this. And slowly and slowly, I think we all can come to this holistic approach, and rather than this body-centric approach. So I is the means. If I is the priority, and I think the body will be taken care of. So this is how we go about, and then uh, it shows the results. Like students are at least getting this perspective, and they are coming up with this. So that's my perspective. Thank you.
Thank you, sir. Thank you. And I would like to next ask Dr. Vidya. Dr. Vidya, what is your idea about this? Do you think it is time that we start addressing the role of self in the health and ill health of human beings?
Am I audible? Is it okay?
Yes.
Am I audible?
Yes, yes.
Very good evening to all. Like the panel members have spoken before, like they have given all of more of theory informations. Even though I don't have much knowledge on that, practically what I feel is like if we have a family, there will be a breadwinner for that family. That breadwinner, usually his thought will be like, I can even die for the happiness of the family. They are ready to die for the happiness of the family, but they are not ready to spend 20 minutes for walking. They are not ready to spend their taste, they are not giving their taste. They want only tasty foods. They don't want healthy foods. They don't want to sacrifice all those things. They don't want to do routine exercises. They don't want to do routine workouts. They don't want to keep their mobile phone away from there at least for an hour in a day. So they don't want to give up all these things which are very, very simple, but they'll say, I can die for the happiness of the. I think this mentality has to be changed. So, first thing is they should realize all these small, small things are the one which are the wealthy, most wealth they are going to give to the family. So it's not the money, it's not the house they are going to build, it's not the jewels they are going to get for the family. That doesn't matter. So taking care of their self and being healthy is the biggest prosperity one can give to their family. So this thought has to be cultivated in each and every one of us. This is my feel. Once they know this, they realize this, they will definitely take care of their health. If they are doing that, automatically their kids will be following the same. So if one family is changing, on seeing that, other family will be changing. And then whole place, and it can be expanded to the whole country and so on. Like as you said, human is not a single individual. It's a part of, we are all part of the society. I think this one small thought change or this one small move will make much better change in the society. So that's my opinion. I think I am not much of theory, but make this is the current situation. So if we change, like if we take care of ourselves, our health will be changed and everything will be changed. This is my opinion on that.
Very true, Dr. Vidya. And we also have from our attendees, our participants, Mr. Prakasam. He has said, yes, it's true, whatever you said. And even I can say that it's true. Now, youth and kids, they mostly don't listen to adults, but they tend to follow us. They very carefully observe what we do. So if there has to be a change, maybe it has to start from us. So that's very true. Yeah. Thank you, Dr. Vidya. And I would like to next move on to Dr. Umang Munjal. Ma'am, what do you think, ma'am? Is it the right time that we start addressing the role of self in the health on a priority basis?
Thanks for the question. Yeah, in my opinion, I think it's the right time, or I would say I believe it's the right time to think of the self, because I've experienced this by myself. Last year, my father had undergone a surgery. He had met an accident and undergone a surgery, and he's 80 plus, and we just lost the hopes. But then, I mean, we were totally surprised because he is also like taking care of self and indulging in a lot of activities like spiritual activities. He writes, he does yoga, he does om chanting as well, and other things. So even the doctors were surprised because he had undergone multiple surgeries at that time. And even I would say it was in doctor's opinion, when a young person would have left the hope, but my father, he didn't leave the hope. And we too were totally surprised. After 5 to 6 months, he was completely on his foot. So I would say it's my personal opinion, or there's a personal experience, that whether, if, yeah, definitely medicine, we couldn't leave the medicine or surgery on the other side, one side, but the total holistic approach was helpful for us, so that he could stand on his feet, walking on his own after certain period of time. So surely holistic approach, self-centric approach is needed here. And additionally, as the previous panelists mentioned, that we have to include the youth, you have to include the children on this side. But additionally, I would also like to include, we should more include more women, or women empowerment also, I think, because as women, he is the caretaker of the whole family, not only in India, but internationally, I would say. And it is said that if we educate one woman, we educate a whole village. So it's here, if we make women aware of self or taking care of their health, so definitely it will help the whole family taking care of their health. So surely it's the right time to address this question and take the self into consideration. Thank you.
Thank you, ma'am. And on behalf of the panel, we wish you best luck for your father-in-law, and we are all happy that he's back. Yeah, that was a very really touchy story, and the experiences from that, the lessons we all learned, that's really true and amazing to see. At his age to come back, no, when even the medical professionals have said there's a little hope. So that's really really highlights the strength of the self on how it can just take care of the body. So that was really nice, ma'am. And the thing you said about women, like how if we educate one woman, she can take care of the entire family. I That is really true because at least in our culture, in Indian culture, women are the one who stays in the kitchen, who cooks. So what we say is that at least one person in a family needs to take responsibility for the health of the whole family. And if it is the women, then it becomes much easier also. So that was nice to hear from you, ma'am. Thank you. Thank you for that, ma'am. And next, I would like to ask our student panelist, Mr. Shobit. Shobit, what do you think? So you're in your MBBS studies, you're doing your second year. Um, what do you think about this self and role of self in the health?
Yes, ma'am. So, ma'am, when we talk about the role of self in medicine, especially in the context of mind versus body and holistic health, we must accept one truth, one universal truth here. A human being, a complete human being, cannot be divided neatly into mind and body. In real life, the mind and the body, they're constantly communicating with each other. Some examples cited, like stress can raise blood pressure, for example, fear can worsen breathlessness, and hope, as cited earlier by previous participants, the hope can improve recovery. uh, and chronic illness just doesn't damage organ, it also affects identity, emotions, and purpose, in my opinion. So treating only the body while ignoring the mind is incomplete medicine. Holistic health reminds us that a patient is not just a diagnosis or not just a lab report, but a person with thoughts, emotions, relationships, beliefs, and fears. Two patients with the same disease may heal very differently depending on their mental status, depending on what they're going through in the moment. The self of a patient, what we talk about, the self or the soul or the mind, plays a major role here. When patients understand themselves, manage stress, believe in recovery, and feel involved in the care, outcomes improve significantly. Healing becomes something that they participate actively in. Equally important, I would like to highlight here is the self of the person who is giving the care, the caregiver or the doctor in this example. The doctor's presence, tone of voice, and ability to listen, and ability to communicate what the next step or what the prognosis or what the next step in the medical care will be is very important. Sometimes just being calm, attentive, and kind is as powerful as just the prescription. Holistic medicine goes beyond curing disease. It focuses on healing the person. So, in essence, holistic health teaches us that mind, body, and one, and the patient and the doctor, most importantly, is central to healing. That's all, ma'am.
Thank you, Shobit. It's very nice to hear, no? Because in medical curriculum, we don't have any reference to self, but still, being in second year, you're able to see so much, and very rightly pointed with the real life examples like fear increases BP and all these things you're able to see. That's nice. Thank you, Shobit. And I would like to ask Miss Aditi. Um, Aditi, we have been speaking about this psychosomatic diseases. That is how the like what our previous panelists also said, how our mind it has an effect on the body, and so a very disordered mind, how it affects the health of the body and causes diseases. So these psychosomatic diseases. So do you think we really understand the root cause of such diseases? Like, for example, we say high blood pressure or high blood sugars, diabetes, and all these things, even cancers. So, do you think this modern medicine or even your naturopathy, just throw us some light? Do you think we really see the root cause of these?
Yeah, after listening the proposal, I am able to say that we have not understood the completeness of a human being. We have just understood the mind and body connection, which is beautiful, and we are really grateful for that knowledge is given. So it's good knowledge, but the it is not complete. Okay. So unless and until we understand the self, which you gave the proposal of self. So as I was saying yesterday, that by being healthy, what I need to do, I don't know. Okay. When I do yoga, I don't know the end result of yoga. In naturopathy also, we talk about the soul and body connection. But what is soul? We don't under I didn't understood it that much completely, so that I can say. And when you talked about self, that time I know that by doing yoga, what I need to do is I need to contribute, like Vidya ma'am was saying, I need to contribute in my family. Okay. And I need to make as a family, in that also I can contribute mentally also, not only financially or physically. I need to contribute mentally also. So here I want to talk, yesterday I talked about a loop in which we are trapped. I want to talk about another loop. I think I am and youngsters are basically trapped in, which is we will talk about very big topics like pollution. Okay, everything we'll talk, but what we will do is we will discuss all the things, and especially about me, I can say about me, I won't talk about others here. What will I do is I'll discuss about pollution, I'll discuss about global warming, and unknowingly somewhere I'm contributing in global warming. So what I'm saying is global warming is very bad, pollution is very bad, and then I'm using the machines unnecessarily. I'm going in the gym, I'm doing the training, I'm eating junk. And unknowingly, I am contributing in pollution and I'm discussing about pollution. So I'm stuck in this loop. I don't know what to do. Is just I just want to discuss it, and after the discussion, what is the conclusion? I don't know. So the UHV, I think, is giving this very small step. What I need to do from here? What step I have to take? So I really like that thing which you discussed. Like we need to focus on health instead of medicines. We need to focus on I think labor
instead of that exercises we are doing. There is no conclusion of that. So, yeah, this is what I wanted to express. Thank you.
Thank you, Anti. Yeah, and thank you. And let me ask Mr. Nilanjan. Nilanjan, what do you think about psychosomatic disorders? The mind-body connection, the effect the mind has on the body.
Yes, ma'am. So, psychosomatic diseases, basically, our minds talk to our body. So, in autonomic nervous system, so there will be two systems there. One is parasympathetic and sympathetic. So, parasympathetic system basically rest and digest, and sympathetic system uh, is response for fight and flight. So, in common psychosomatic manifestation, there will be holistic vision for the treatment is that in psychosomatic awareness first. So, learning to hear the body, and if we have the recurring the suppose somebody having backache in Sunday night, so we have to thought that next day, like Monday. So what is the situation? Like feeling about the Monday, and next, mind and body intervention. So cognitive behavior therapy, we can follow that, or in that we to review that cognitive behavior therapy, that we understand the what is the trigger pattern of the stress response. And in biofeedback, so we can using the some sensor, like nowadays, some watches are coming, so we can see their heart rate monitoring, muscle tension. So real time, like when we get stressed, so we can see the heart rate will be increasing. So we can monitor the things, and we can treat the stress response. Next, mindfulness and based stress reduction. We have to do yoga therapy and exercise, and we have to train ourselves when we are getting stress. So we have to manage our stress. Then another thing is that lifestyle integration. So food and nutrition. So reducing stress or inflammatory response, we can avoid the foods like caffeine, sugar, and whichever food make us more excited, so that we have to reduce. And proper sleep is the very important thing, so that will reduce our stress. And so these all things are basically cure the psychosomatic diseases, I believe. Thank you, ma'am.
Thank you, Nilanjan. Yeah, thank you. So you have basically mentioned all the causes that lead to psychosomatic diseases. Yeah, thank you, Nilanjan. Thank you for that. And I would like to ask Dr. Vidya, what do you think, Dr. Vidya, about these psychosomatic diseases and the root cause of them? Does the modern medicine address the root cause?
Yes, what I understood about psychosomatic diseases, psycho means body, somatic means, psycho means mind, and body means, somatic means body. So whatever stress or anything which is going in our mind is constantly going to affect the health of the body. Say, for example, if we have stress or emotional imbalance, or we cannot control our emotions, in that state, what will happen? Some stress hormones will be released. These stress hormones will be having an impact on our neural system. So, due to this, there will be some physiological changes happening in the body that is going to manifest outside as a disease. So here, say for example, one such example, as we all know, hypertension and diabetes can come under psychosomatic disease. So the real allopathic treatment, what we are giving is mainly we are going to address the BP level and the sugar level. As I told yesterday, we are going to give medicine to reduce the blood sugar level, say for example 500 to 150, or we are going to reduce our BP level to 140 diastolic to 110 or less than 90. That will be our target. But we are not focusing on the root cause, to be frank. Some days or sometimes we are giving some lifestyle modification advices also, but we are not stressing much. Instead, what we will be stressing as a doctor is please take the drugs regularly. Don't skip any drug. So always have the drug with you when you travel also. So don't skip the breakfast. Like that we are telling. But we are not insisting much about the lifestyle modifications. So we are not having enough time also to sit and explain briefly about the knowledge of the disease. We are not impacting the knowledge of the disease. So as of now, it is in the other hand, 60% we are very much focused on treating the disease per se, but 40% only we are focusing on the root cause. I think if we balance and if we can move the 60% or 80% to the treatment of root cause, everything will be settled. But it cannot be done in a overnight. In a long run, we should plan accordingly our treatment, and it has to be processed in such a. So that is my experience. What from my life. Thank you.
Thank you, Dr. Vidya. It was very nicely said. There are actually many recent publications, like we saw yesterday also, how stress causes this pro-inflammatory changes in our body. Lot of inflammation is getting triggered in the body, and that seems to be the cause for most of these diseases, like high blood sugars and high BP and all. And you've rightly pointed out how our modern medicine is giving tablets only to reduce the sugar, reduce the BP, and even keeps advising us to keep it with us and take it for lifelong. Yes, and that only causes stress to the patient and increases their BP. Next time they come, their BP is even higher. Yes, thank you, Dr. Vidya. And I would like to move on to Dr. Sujata now. Ma'am, what is your view on this, ma'am, about these psychosomatic diseases and how is the current health system? Do you think it is adequately addressing the root cause of these diseases?
Ma'am, yes. Regarding this, I want to quote one serious example here. One of my close friend, actually, she is very much addictive to the work. She is completely workaholic. So in such a way, only I have to represent. She used to get up in the morning by 4 o'clock, and she used to cook after the getting up. She used to cook, and she'll be getting ready. And by around 8:30, she'll be to the office, and she'll be back by around 5:30 after having the something, some snacks or something. Again, she'll be sit in the computer, and she started doing her work up to 12 p.m. And again, she's getting up in the next day morning, 4 o'clock, like that routine work it goes. And on one day, she was totally collapsed at the age of 45. 45. She was totally collapsed, and her husband took her to the hospital, and it was identified that it is brain aneurysm. It is only because of less less sleep, and complete stress. So what she had a feel that it's all right, and she able to do all the works on her own. On that feel only she started doing all the work. But she herself doesn't know that something is going on in her brain, and it got ruptured, and totally she got collapsed on a day. So this is because of not following the effective routine of her health. That's what it is really highlighting, alarming. After seeing her in the hospital, I felt very bad because she's very close to me. Seeing her in that condition, and I thank God that she's alive. So that is what I have to say here. So the thing is that, like this, if you are taking the stress towards us, surely it will affect us. So it's an example for all of us that without knowing the things we are running, And as Vidya ma'am stated, what is happening, what is going to happen, we don't know, but we are running in our life. We don't know. We are going to catch this train, but we should not lose our life train. So that is what I have to mention here, because this stress will give a complete. I don't know how to represent that word. So it is actually giving a very bad impression to the body as well as mind. So we should not take any stress before going to the bed, and we have to have a good sleep, as Nilanjan mentioned. Good sleep or heavy sleep is required. Without any pills, we have to take the sleep. Once if we lay down on the bed, we have to sleep within 5 to 10 minutes. We should not think of any of the matters what has happened the day or the previous day like that. So once if we think about those things, again it will give another stress even in our sleep also. So it will disturb our sleep also. So we should not do that one. This is the request to the members I'm putting in this panel. Okay, thank you.
Thank you, ma'am. That was really something a very serious issue actually, which you said about your friend. And being in medical field, I think Dr. Vidya would also be hearing about it. Recently, in the past 6 months, we have been hearing news about sudden death of young doctors in the age group of 30 to 40 years. They go to work one fine day and then they work for 48 hours and 36 hours continuously, and then they collapse in their workplace and they are not getting revived also. So every month we get to hear one or two such news, and that's all very scary. Like how, like your friend, people are running behind work without knowing why they're doing that work, for what purpose they're actually living. So it's rightly said. Thank you for that. And so now let us move on to the next session about the role of self in the financial burdens of the society. So we have been discussing about the psychosomatic diseases and the role of self on the physical health of the body. So I would like to ask Mr. Swapan sir. Sir, we discussed yesterday about these concerns regarding the high financial burden in our society. So, do you think that when we look at the health in a more holistic manner, including the importance of self, do you think that could be a solution for this financial burden in the society?
Yes, definitely. I think because we are talking that these psychosomatic diseases are all lifestyle diseases, means we are not able to take care of our body because even we are not even aware that what is the purpose of my body. So health, we all are talking about that. Okay, we should work on our health and all. But even the youth, whether the youth is clear whether with this health in the body, what will we do? So can we take this body as an instrument, instrument of right understanding? As you said that it is I who has to be happy. I need happiness, and body needs just physical facilities. But if this clarity is not there, and if I am considering myself as body only, so I get into overindulgence, and then the body is rather means it's getting spoiled, and all these psychosomatic diseases are there, and then we can all see that because of the psychosomatic diseases which are means which can be prevented very easily, but for that we have to bring it in the education. Like for example, even the youth, you can see the life is becoming very fast, it's very competitive. So this when this concept of I is not there, so this stress issues and all that, even the mental health, as your presentation says that it is again being treated through medicines only. Means even we don't have the tolerance level. Like if the stress is there, obviously the headache. Even for the headache, we are trying to take a lot of medicine, and then means this concept of getting rid just managing the disease. So it's a lifelong. So instead of going to the root cause, if you're just going to this again and again, we are trying to manage the disease. So there's a loop, like again and again, we are going to the hospital, and the patients who deserve the attention of the doctor, they will not be able to get it. And then obviously, because if you go to the hospital, there's a profit maximization, the cost is going to increase. So this financial burden, I think, can be prevented again if you will bring this holistic human health as a course in the education. And then I think this concept of holistic approach, I and the body, and then if I will take the responsibility of the body, then I think a lot of these people who are going to the hospitals with all these diseases, they will not be there. And then obviously the cost will come down, because then we are not scared of, okay, we have to collect a lot of money because I am taking the responsibility of my body. Then I think there is no need of extra money for this. So definitely, I think this concept of self can decrease the financial burden on this health system, and sustainability will come naturally. That's my take. Thank you.
Thank you. Thank you, sir. And Miss Aditi, yesterday you were telling about when we discussed about the same concern, the financial burden of the society. Now, do you think that this is a solution, like giving priority to the self? Do you think that can reduce the financial burden in the healthcare system?
Yes, ma'am. I think it can definitely reduce, because when I will realize the value of self, when I'll understand the real self, what is self and what is body. Because right now, currently what is happening, I'm accumulating money for my body because I'm thinking I'm the body. So I need unlimited money because I want unlimited happiness. Um, I am accumulating money to fulfill that unlimited happiness. I don't know that unlimited happiness is self want that unlimited happiness. The body doesn't need it. I'm eating a big tub of ice cream when I'm sad because I'm thinking that unlimited happiness will come from that tub of ice cream. Okay, my hunger is done, but still I'm eating because I want so much happiness. When I'll realize the value of self, I'll realize my needs, my real needs, and I'll earn money not to impress people, not to get respect from people, not to satisfy my self desires of self. Now then I'll know how to accomplish desires of self. So instead of snatching from others and fulfilling the desires, I'll know my proper needs and I'll be able to fulfill them. So definitely it can solve the problem of sustainability and money. So yeah, this is my take on this. Thank you.
Thank you, Aditi. Yeah, thank you. And what about Mr. Nilanjan? What do you think? So there's concerns regarding the high financial burden in the society, and we also saw about the unsustainability of the healthcare system. So do you think understanding the role of self on physical health could be one possible solution for this?
Yes, ma'am. Understanding the self, that will be definitely help us to reduce the financial burden. Because if we are previously conscious about our health, so definitely that will reduce the diseases, and that will lead to less financial burden. So I agree with that. And even we can do some previously prevention is better than cure. So before coming the disease, we have to take the prevention for that. So that will even some people are to do, like they used to take insurance policies, so we can save money, insurance policy that will use in our, like suppose we get get any diseases, so we use in that cases. So that will reduce the financial burden. That home mindset, ma'am.
Thank you. Thank you, Mr. Nilanjan. And now I would like to ask Dr. Umang Munjal. Ma'am, I remember even yesterday you were telling about the cancer and chemotherapy and how costly they are, and the importance of the self on the body. So can you just throw us more highlight on this, ma'am? Because that seems to be aligning with our vision today, the role of self on reducing the financial burden in the healthcare system. And please unmute yourself, ma'am. Unmute yourself.
I'm sorry. Yeah, was not aware.
Thank you. Thank you.
Yeah, surely. I definitely would like to share here also one of a small experience which I encountered last year when I visited India. I came across with I met one of the clinician there, and it was very good thought what he shared with me, that while diagnosing a patient with some diagnostic tests, don't take the diagnostic tests only into consideration, because sometimes the diagnostic tests don't reveal the whole body or the whole results. So just take into consideration the clinic, the patient also, how he is feeling. Yeah, if he's feeling good, then maybe if the test is not good, but take that into consideration, his feeling, how he is responding to the therapy. So maybe according to that feeling, we can reduce some of the tests here, because after doing one of the diagnostics, as if it's not working, then we go for 10 other tests, which is adding the financial burden not only on the person, but on the, let's say, if he or she has got an insurance, that will be a burden on the insurance as well, because we can't rely only on the insurance for chronic diseases. Yeah, so it was a very good point that he put forward. Not only the diagnostic cells, we have to take the whole body and self, let's say, into consideration before going or thinking for another diagnostics test. And additionally, moreover, I would like to highlight the point here, because I've done this work in cancer prevention, not cancer therapy. So prevention, if we take into consideration the word prevention, it adds a lot, and definitely will reduce the burden on the whole society, not only the patient, not only the pocket of the patient, the caretaker as well, the society and the environment. What we talked just now, that patient, I am not self, I am included, I includes the whole society, the whole environment. So surely, if we take these points into consideration, will reduce the burden on the whole health system. And here, to add on this, I would like to ask, because when the person comes for the follow up, we always ask whether he or she has taken the medicines properly, but we are not concerning, or we are not asking whether he has done some changes in his lifestyle accordingly. Yeah, what panelists, yeah, told just now, the taken the kind of sleep, or the lifestyle changes. These are not never talked in the follow-up sessions. These are only talked in the very first visit. So if we can add here as well, additionally to the medicines, the follow-up sessions, these things surely will bring the burden down on the society. And if we can include not only these, the emotional help to the patient, that also will help the patient moving forward. So that, I think, we have to take into consideration. If we take these things into consideration, will surely bring the burden down. Thank you.
Sure, ma'am. Sure. Thank you, ma'am. Mr. Shobit, so what is your idea about looking at human being in isolation, or should we look at human being as a whole? Like all our panelists, and even our previous panelist, Dr. Umang Munjal, she has stated that don't look at human being as a single entity, include the family, the society, and all. So, what do you think about this? When we deal with the health of patients or health of your friends, do you think that the relationships they all have an impact on the health?
Yes, ma'am.
Mr.
As
Shobit?
I previously stated, and all the panelists have stated already, that to look at human being as a whole, we must look at mind and body together. But to bring this question to the current topic, which is financial strain, what I would like to say is that financial strain is not only economic, but it is also psychological and behavioral. Our attitude and our compulsions towards money, consumption, and responsibility directly shape our personal and social financial health. When individuals lack the self-awareness and the self introspectivity, it leads to uh, it leads to problems such as overspending, debt, financial stress. These problems become common and eventually they burden families and burden people. The self at an individual level, ma'am, the self at an individual level to be looked at just with the lens of financial strain would imply that we look at just a single frame. But that is a very mono nuclear view that we look at. But my opinion would be we must look at it with a wider view, with a wider lens. That's all.
Thank you, Shobit. Now I'd move back to Dr. Vidya. So, in our very first question, you answered the importance of family in the health. So, I'm again putting this question to you. So, when we deal with the health of a human being, do you think we need to look at him isolation, especially when you treat your patients? Do you even consider no, the role of relationships, society, and the health of environment in which the person lives? What is your insights and direct experiences in this, Dr. Vidya?
So what I would like to say is like holistic human health. We are talking about holistic human health. So this holistic human health will not be exact other way for the modern medicine, but it can be a complementary to modern medicine. That is my opinion. So it can be a powerful and it can be a sustainable tool to improve the financial burden of the society. So if one person is taking care of self, as I told you, if in a family member, if the breadwinner is going to take care of health, that is the wealth for that family. Say, for example, if a old age patient, old age mother or father is staying in that same house, if they are healthy, they are reducing the financial burden of that breadwinner. So, this holistic health is going to play an important role at each level. Say, for example, at an individual level, that individual medical bills or medical expenses will be getting reduced. If you see as a family whole, that the medical expenses for that family, that insurance kind of things, all the expenses will be getting reduced. So when you see at a community level, so nowadays we are spending more money for this non-communicable diseases, psychosomatic diseases, and mental illness. Like we are having more of preventive programs, and government is spending much money to conduct all those programs for conducting the screening test. Even though it is a screening test, still it is a financial burden for the community. But if we are maintaining the self-health or the holistic health, all these burdens will be reduced at the community level also. So nationwide also, if everyone is healthy, the national programs to eradicate the diseases also will come down. The financial burden of the nation also is going to reduce drastically. So it is not an individual thing. Definitely, it is going to affect the entire society. We cannot see human being or an individual as any individual. Instead, definitely it is going to reflect in the entire society, in the entire nation. So this is how it is be going to affect. But there are some limitations also in this holistic health approach. What I feel is like it is not a short-term measure. It is a long-term measure, and it needs more of behavioral changes. which cannot be done immediately. And another thing, it needs lot of awareness. So there should be some role models. Their people should get more awareness. They should accept for this lifestyle modifications. They should accept for the behavioral changes. So once in a long run, this is going to benefit a lot. For that, it is a high time to share all our views in a right platform like this so that everyone will understand the importance of the holistic health and ultimately we lead for a better nation tomorrow. So that's my opinion.
Thank you, Dr. Vidya. So you have already opened the forum. You have already opened the forum for tomorrow's discussion. So tomorrow we'll be discussing about the different ways we can implement this vision. And I think you're already ready for that. Thank you. Thank you for that. And I'd like to ask Mr. Swapan Chanana, sir. Sir, what is your view on this, sir? So should we be looking at human beings in isolation, or do you think this family, relationships, society, and nature, they all have an impact on the health of an individual?
Right, ma'am. I think we have been discussing like since yesterday and even today this holistic approach. I think isolation approach has made us to reach nowhere. Like for us, again, human being, holistic approach is the self and body approach. So I think self is the priority. If the self is the priority, then obviously I will means under the right with right understanding in the self, I will have a sustainable feeling in me, and that will lead to the harmony, continuous harmony. And then when harmonious self is there, it will obviously take responsibility of the body also. Then I will be working on my daily routine and all means those sustainable efforts to make my body also healthy. And then once I am in harmony, then obviously the next participation, the compassion will come, my role. It will come in the family, then I will work for the harmony in the family. And then once there is a harmony in the family, and then the other families, like other panelists are saying, that they will be motivated. And then again, we will work on their right understanding. And then there is a harmonious society. And then obviously, then I have a compassion. I'm feeling related to the nature also. Because today, again, I'm telling you, the North India, right now, we have a lot of, it's an issue, big issue, but it is being taken into isolation only. Trying to solve nature only means this pollution in isolation, it can't be solved unless it's all related. Because if we all human beings feeling related towards the nature, then I will be fulfilling for the nature also. So I means it's all connected. So I think it's high time that this holistic health approach comes into our education, and then I think all these problems will be solved. It's connected. So I think this holistic approach is very much needed. So I'm looking forward to tomorrow's session, means the implementation of this holistic human health approach. Thank you. That's my take. Thank you.
Thank you. Thank you, sir. So that was a really nice discussion we have been having, and we are left with only a few more minutes. So I would like to open the forum for a discussion with our participants who are here. And we also have question answer option here. If any of the attendees here who are present, you need to ask any specific questions to the panelists, you can raise your hand. We'll pass on the mic to you. Or even among panelists, if any of you have any questions that you want to discuss, ask any particular other panelists.
Yeah, Didi, in the chat, yeah, right now we are having a hand raise by Didi, I think. Sujata Didi wants to say something. Otherwise, I'll read from the chat. Yes, Sujata Didi?
Yes, ma'am.
Yes, ma'am.
Actually, I want to put a question to Vidya, ma'am. The point is, on self, if we are going to take care of our health, anyhow it will be supporting less weightage for the financial burden. That's true. But we are actually living in an environment which is completely dealt with adulteration. So we couldn't step out from that. If you imagine that in 20 years before, the life insurance companies are very less. Nowadays, it is in every street. I have to say like that. Every street, one life insurance company is there. Health insurance company is there. So the health insurance company are having a very big hope that surely more health calls will be there. So we have to approach the teams and we have to make our company to grow. So in such a way, it is there. So even though if we are trying ourselves to come out with a better way to reduce the financial burden, the environment as well as the people will not make us do. So what we have to do.
Ma'am, what my opinion is, before doing something, before saying something, we have to do. So that is my thing. Like before we say, like we teach our kids to do exercise regularly, to do to eat healthy food. My thing is first we have to follow that. If we are not touching the mobile phone for a week unnecessarily, they won't also ask. So every change has to begin from the self, from ourselves. So we as a parent, if we behave in a proper way, I think it will be cultivated by the kids automatically. And then if a family changes, everything has to be changed automatically. So one thing is like, ma'am, we are in a era like where modern medicine has taken up all the things. It nothing can come and immediately change that. So slowly, we can take step by step. We can try to change. That's all we can do at this level. So this insurance company or pharma company, all things are there, and they have own credits and merits and demerits. But we cannot go into all these details, and we cannot go and change everything in a short term. It will take some time, but definitely it can be changed. That is my point. Slowly, if we start a stage at family level, automatically it will reflect at national level. So one incident you told, no, ma'am, your friend, that sad incident you told. So what I felt is like, even though that madam was workaholic and she was ready to, if she could have taken some help, some yeah, for homemaker, home help, some maid, cook or whatever it may be, and if she would have taken some nurses to take care of the elders at home, so small modifications she would have done, but she didn't think of anything. She want to do everything on her own. So that attitude, that perception has to be changed. First, we will tell no, ma'am, if there is a wall only, then we can draw the painting. So first, we should take care of ourselves, not because to safeguard ourselves, to safeguard the family. If we are strong only, we can take care of our family. That thought should come into our mind. So we should have some self-care. We should practice this holistic health practices. Slowly, it will be cultivated by our kids. Slowly, this change is going to happen in the nation. So we'll pray for that. That's all we can do.
Thank you, ma'am. We'll hope for the best.
Thank you. Thank you.
Have a chat message from Marisa ji as yesterday. It would be nice if we can pass on the mic to her if she raises hand. It would be nice to interact with you, madam.
To Marisa ji.
Yeah.
Marisa ji, no? I've passed on the mic to Marisa ji.
Yeah.
Hi, hello.
Hello, ma'am. Welcome.
Thank
Hi,
you
ma'am.
for giving me the time to share. Yesterday, I shared about frequency medicine because it's one that I have been using for myself to stay away from pain because I have scoliosis and and that causes me pain at the back. But when I use frequency medicine on my back, that means using a gadget that gives me hit, my pain is gone. And it's cheaper for me rather than go to a chiropractor for treatment of my scoliosis. So this is a technology that has been introduced to me about 2 years ago. And it's something that I find very basic for one to keep one's health. It's very basic because it targets energizing the cells. So when the cells are energized, it is able to function using its innate healing capacity. And can be done at home. I find it very it's very useful. So it keeps me away from expensive healthcare, going to the hospital, going for emergency. In fact, I used this technology to be able to cure my asthma. I've had my asthma when I was younger, but since I used it I started my holistic wellness practice in 1997. And since then, I've been open to exploring ways of how I can promote holistic health. So I've done it on myself, got rid of asthma without the steroids, without the inhalers. That's it. If you want to know more, I can share with you more details. What else?
Thank you, ma'am.
Yeah.
We would definitely like to hear more from you, but it's almost time now. But we do have our panel, third day panel tomorrow, and it'll be nice if you can join us tomorrow also.
I can, yes.
Thank you, ma'am. So, if there are any other questions, or I would just give a quick summary of what was discussed. So today we saw about the vision, a holistic vision, where a human being can be seen as coexistence of self and body. And we discussed four major paradigm shifts, that is moving from symptom suppression to treating the root cause, and moving from disease-centric approach to a health-centric approach, moving from body-centric approach to self and body approach, and moving from seeing ourselves in isolation to understanding that we are a part of a larger whole. So this much we have discussed today. And as the last two panelists have very aptly opened up the forum for different ways to implement this vision in health education system and in the society. So tomorrow we'll be having our third day panel discussion, where we'll be discussing about the different practical ways in which this can be taken up to the youth, to education systems and the society also. And just a gentle reminder, tomorrow the panel discussion, it starts at 8:45 p.m. So we'd all assemble here by 8:30. So that is it for today, and it was really very nice having you all here. And I thank really the attendees and other delegates who have joined through various other channels. And you have really kept this panel discussion very lively with all your comments and everything. So thank you all. Yeah, and we have a comment from Dr. Brindeshwar. Sir has said that self-consciousness related to spiritual component of health is very important to include in health and wellness programs. Yes, thank you, sir. So that is it. We can close the
Thank
forum.
you.
Thank you
Thank
all.
you.
Yeah.
Thank you,
Yeah.
everyone. Thank
Thank
you.
you,
Thank
madam.
you. Good.
Thank you, everyone.
Take care.
Thank you, everybody. Tomorrow itself, we'll be discussing implementation of the holistic vision that we have talked about today. So do see you all tomorrow at 10:30 Indian Standard Time. Thank you. Namaste.
Thank you.